So I'm talking today about subtotal ossification of the acetabular labrum. Presence of radiographic paraacetabular radiopacities in patients presenting with FAI is not uncommon. However, a thorough review of literature revealed marked variation about the definition of different forms of labral ossification and calcification. For example, intralabral ossifications, subtotal ossifications or pony apposition, and labral calcifications, and true os acetabular discrete mineralization. In bony apposition, Corton et al. Described two processes by which the labrum was either encased by ossific structures, giving the appearance of the recess sign, which could be seen in the X-rays, or instead it's pushed forward and thinned by an underlying bony process along the posterior wall, giving the appearance of the double posterior wall sign. Other authors have concluded that these lesions should be grouped together with acetabular osteophytes and may represent early stage of osteoarthritis. Several previous studies correlated labral degeneration with degenerative changes of the hip joint, also with alteration of the labral quality, which may play a role in decision-making for management of labral tears. So the aim of our work, all these findings figured the hypothesis of our study, which was an observational cross-sectional study for descriptive analysis of the incidence, radiological markers, and intra-articular pathologies in patients with labral ossification and calcification. All our patients were operated in OTM hospital between October 2018 and October 2020. We included all skeletally mature patients with primary arthroscopic treatment for FAI and radiological radiopacity at the site of the acetabular labrum, and all included patients should have undergone arthroscopic confirmation of the nature of the lesion. We excluded diagnosis other than FAI, patient without radiopacity in preoperative radiographs, those who didn't reveal was not revealed intraoperatively, or revision surgery. Data collection, personal data, clinical data, and radiological assessment. Different femoral and acetabular radiological parameters were thoroughly evaluated and gathered, and the radiological characters of the radiopacities. Surgical technique briefly: supine position, traction, identification of landmarks, wrapping. All our patients were treated with the peripheral access first technique, which was developed by Professor Dienst and colleagues. Proximal anterolateral portal and anterior portal for the peripheral compartment. Peripheral compartment examination. The labral stability could be assessed from the peripheral compartment using the compression flip test, followed by cam lesions anteriorly and laterally. Cam resection. This is followed by central access and traction. In 5 patients, traction was inadequate for passage of the instruments to the central compartment, and central access was aborted. Diagnostic tour in the central compartment. And the labral stability was reassessed again during central compartment by probing in both directions. You'll see unstable labrum and highly unstable labrum, which could be pushed in both directions. The rim cartilage was evaluated by the Mahon classification system, and the non-rim cartilage, the remaining cartilage, was assessed by the ICRS classification system. All the data was gathered for statistical analysis. So during the study period, 611 patients were operated in our hospital. So 70 met the inclusion criteria. The first group was intralabral ossifications at the base of the labrum, well-formed bone near the base of the labrum. The second group was labral calcifications with a chalky white material near the base of the labrum. And the third group is a subtotal or total ossification of the labrum with replacement of the whole or partial height of the labrum with bone. So the subtotal ossification group showed the operative age was significantly higher, and the duration of symptoms was longer than other group, and significantly lower abduction range of motion, and significantly higher incidence of posterolateral and anterior extension of the lesion. Also, there was higher incidence in the patients with subtotal ossification group of triangular lesions, replacing the site. Oh, sorry. Can I get 2 minutes more? Sorry. The lateral center edge angle was measured to the original, to the acetabular sourcell, and to the most lateral point of the lesion. And interestingly, the lateral center edge angle increased from average 28 degrees to 48 degrees, and the acetabular index decreased from 5 degrees to minus 13 degrees. The subtotal ossification group showed significantly higher incidence of the double posterior wall sign and the recess sign in X-rays, and significantly higher incidence of acetabular and central osteophytes. During arthroscopic evaluation, it showed significantly higher incidence of posterior extension of the lesion than other group, and higher incidence of either failure or difficult of central axis than other groups, and higher incidence of deep condyle damage of the articular cartilage covering the ischium and femoral head according to the ICRS systems. Also, higher incidence of pincer phi and secondary osteoarthritis was noticed. Okay, this presentation. Preoperative plain X-ray of 55 years old female with right hip pain of 28 months duration. Here you can see coxa profunda, slight medial joint space narrowing, small anterior cam after cam resection. And here we can see the subtotal ossification of the acetabular labrum with a small labral rim left. Also, we can see condyle damage in the ischium and the pubis, which is typical for the contour cube lesion seen with pincer deformity. Also, small central osteophytes were seen. Arthroscopic appearance after acetabular recession, and post-operative radiographs. Another patient, 33 years old female with 16 months duration of hip pain, showed total ossification of the acetabular labrum. Here we can see the totally ossified labrum without any labral rim. Cam resection before and after. And rim condyle damage in the ilium after acetabular recession and post-operative radiographs. Okay. Summary: the study revealed prevalence of radiographic para-acetabular densities of up to 20%, and of those 4.7 were subtotal or total ossifications. There are several distinct radiological and arthroscopic characters of the labral subtotal ossification. Advanced condyle damage or labral degeneration was seen in this group. Therefore, in contradistinction to previous studies, subtotal ossification might indicate early osteoarthritic change. It's the last slide, sorry. Just the last slide. Last slide, yes, okay. The long duration of symptoms together with early degenerative change of the joint suggest progressive nature of such lesions and raise a concern about optimal early management of FAI to prevent FAI-induced osteoarthritis. In patients with subtotal ossification of the labrum, are susceptible to difficult or failed central access, so should be considered in preoperative planning of arthroscopic approach, and it affects the measurements of the lateral center edge angle with subsequently under or overestimation of the coverage, which is crucial for planning of preservation surgery. Thank you, and thanks for my mentors, Professor Hatem and Professor Dienest. Thank you.